So ultimately, where does this lead us? So I put this in that a lot depends on biologies. You have good, bad, and really bad. So this is for appendix cancer specifically. And if you notice the x-axis here, this is the number of months that patients can live after surgery. And you'll notice the high curves are the best, right? This is the average number of patients living at certain time intervals. And this can go 5, 10, 15 years on this scale. So patients in blue can go many years not having a problem with their appendix cancer, versus the patients in green and red have more aggressive versions of their cancer and they don't live as long. So selecting the right patients for the CRS HIPEC, when you select the right ones, you can see patients here are cured and living 10, 15 plus years disease-free, which is amazing, because back in just the 1990s, we didn't have this available to us. We did not really know how to treat this disease, and these patients would only live months. So to be able to get cures and advanced survival many, many years is just a huge victory for my field. And we've done this just since the early 90s, as technology has jumped that far. But that means there's still room to go here in terms of these patients that are kind of passing away earlier. Is we need to make progress to help these patients as well. So factors affecting, what curve you end up on there, and how a patient does after surgery, the biology of their tumor, their burden of disease, if we're able to remove all of it, and then their existing medical problems and age before we go to surgery. We know that if you can get the systemic chemo plus the surgery, the cytoreductive surgery and the HIPEC, you do better than just getting systemic chemo alone. And so these patients that we select for surgery, we are able to help them with this. But this, I told you about the risks and the benefits tonight of this big surgery and the extensive recovery. And I just think that for patients, it's very important to go to centers that have experience with this. Peritoneal disease is rare, and so not many surgeons in the country do these procedures. Not many oncologists are as familiar with how to manage it. And so finding a team that works together, knows what they're doing in terms of selecting the right therapies for the right patients, and can follow you up with surveillance, I think that's of utmost importance. And certainly organizations like HIPECtreatment.com help with connecting you to those resources.